Now, work will begin next week on Toronto's first supervised drug injection site.
I'm very pleased to announce that construction will begin at the Toronto Public Health site this Tuesday.
The city is stepping up construction plans to deal with a growing number of drug overdoses. It comes after at least 4 people died recently. The city is also working to quickly get the antidote, naloxone, into the hands of as many trained people as possible. And that includes Toronto police officers, even though the force says right now it has no plans to equip officers with the kits. I spoke to a harm reduction worker from the Queen West Community Health Centre today about the city's plan. He says that while he's happy the city is taking the crisis seriously, there are ways they could improve the response.
I think it could be moving faster. We've been waiting to open a supervised injection service at this location. We've been working on this for years. Our exemption has been approved. But yet we're still waiting for the money to open our supervised injection site. So a big part of opening a supervised injection site will be really curtailing these fatal overdoses and preventing them from happening in our area, giving folks a safe place to use.
And this is so real and so tangible that you already have floor plans. Can you just show us what it would look like here once the supervised injection service is opened up?
It's a small supervised injection site with only with 4 booths.
Okay.
So meant to meet the needs of the existing community that's here. People will check in, they will meet with a health promoter and nurse, get the tools they need to do their injection, and then be supervised and then move to a post-observation area.
And so this is slated to open in the fall, but one of the recommendations that we heard at the emergency meeting was the fact that it should be opened up sooner rather than later, was what advocates were saying. The mayor said, though, that it takes time to build the infrastructure, it takes time to set it up properly. I know you weren't at that meeting, but had you been there, what would you have told him?
What I would have told him is, you know, the want and the ability is there to open a supervised injection site. It would have been great to be at that meeting to even make recommendations. Do we have a temporary pop-up site until completion of this?
How would those be able to operate properly or safely as they have in other jurisdictions? How would that even work?
Well, we have a lot of the staff and the capacity. We've been addressing this overdose crisis here for years. Myself, as well as others on this, the team here have seen this opiate overdose crisis happening for 10 years coming. We've been distributing naloxone. We've been giving out harm reduction supplies. So we're kind of some of the professionals that you would want there, along with a big movement of our community and people who use drugs who want this. Maybe releasing the funds for the supervised injection services so that we can hire the staff to run this pop-up site until the physical location is built.
Another recommendation was to have police officers carry the antidote, naloxone. How would that change things? Because we've so far heard from police saying that it's not something that they're interested in doing, even though other emergency responders are carrying naloxone. What do you think the impact of having police officers with naloxone would have?
You know, if the police want to carry naloxone, I think it's great that more people carry naloxone. I would like easier access to naloxone. Right now we're on a very limited supply, so we get it through one of our sister organizations, South Riverdale CHC and their Hep C program. So a bunch of us sites are distributing a very limited, so we divide and basically ration naloxone to the areas that are most needed. If we were able to directly access naloxone, we could put that naloxone in the hands of the people that need it the most.
So you'd rather have easier access than have police have it?
Absolutely.
And Martin also told me that in the last month, he himself has been able to reverse 3 opioid overdoses, so save 3 people's lives. And the center as a whole has reversed 6 overdoses in the last month.